Bone issues encompass a wide range of conditions that affect the structure, strength, and health of the skeletal system. Bones provide essential support and protection for vital organs, and serve as the framework for the body. Various factors such as genetics, lifestyle, aging, and medical conditions can contribute to the development of bone issues. Here are 25 bone health issues that individuals may face. Osteoporosis. Osteoporosis is a progressive bone disorder characterized by a decrease in bone density and quality, making bones fragile and susceptible to fractures. It primarily affects postmenopausal women and older individuals, but it can also occur in men and younger people due to various factors such as hormonal changes, genetics, and lifestyle choices. Osteopenia. Osteopenia refers to bone mineral density that is lower than normal but not as severe as osteoporosis. It is often considered a precursor to osteoporosis and signifies a decreased amount of bone mass, putting individuals at a higher risk of fractures. Fractures. Fractures are breaks in bone tissue that can occur due to trauma, falls, sports injuries, or weakened bone structures, such as osteoporosis. Fractures range in severity from hairline fractures to complete breaks, and their treatment varies depending on the location and type of fracture. Paget's disease. Paget's disease of bone is a chronic condition characterized by abnormal bone remodeling. This leads to bones becoming enlarged, weak, and prone to deformities. It can affect various parts of the skeleton and cause pain, fractures, and complications if left untreated. Osteomyelitis. Osteomyelitis is a bone infection usually caused by bacteria, which can enter the bone through the bloodstream or from nearby infections. It can lead to bone pain, fever, and difficulty moving the affected limb. Treatment involves antibiotics, surgery to drain pus, and sometimes the removal of infected bone tissue. Scoliosis. Scoliosis is a spinal deformity characterized by an abnormal sideways curvature of the spine. It can cause an uneven appearance of the shoulders, hips, or waist, and may lead to back pain, limited mobility, and respiratory issues in severe cases. Kyphosis. Kyphosis is an excessive forward curvature of the upper spine, leading to a rounded or hunched back. It often occurs as a result of poor posture, osteoporosis-related vertebral fractures, or certain medical conditions. Avascular necrosis. Avascular necrosis, also known as osteonecrosis, occurs when bone tissue dies due to a lack of blood supply. This can weaken the bone structure and lead to pain and joint dysfunction, commonly affecting the hips, knees, and shoulders. Bone tumors. Bone tumors are abnormal growths that can be benign, non-cancerous, or malignant, cancerous. Benign tumors, such as osteochondromas, usually do not spread and may not require aggressive treatment. Malignant tumors, like osteosarcoma or chondrosarcoma, require specialized treatment involving surgery, chemotherapy, or radiation therapy. Fibrous dysplasia. Fibrous dysplasia is a rare bone disorder where normal bone is replaced by fibrous tissue, causing weakened bones that are prone to fractures. It can lead to bone pain, deformities, and functional limitations. Ankylosing spondylitis. Ankylosing spondylitis is a type of inflammatory arthritis that primarily affects the spine and sacroiliac joints. It causes pain, stiffness, and limited mobility, and in severe cases, the affected vertebrae can fuse, leading to a rigid spine. Multiple myeloma. Multiple myeloma is a cancer of plasma cells in the bone marrow, which can cause bone pain, fractures, and anemia. It often requires a combination of chemotherapy, targeted therapies, and supportive care. Hyperparathyroidism. Hyperparathyroidism is a condition where the parathyroid glands produce too much parathyroid hormone, PTH, leading to elevated blood calcium levels. This can cause weakened bones, kidney stones, and other health issues. Marfan syndrome. Marfan syndrome is a genetic disorder affecting connective tissue, including bones. It can lead to long limbs, joint hypermobility, scoliosis, and other skeletal abnormalities, as well as cardiovascular and ocular issues. Ollier disease. Ollier disease is a rare condition characterized by the development of multiple benign bone tumors, enchondromas. It typically occurs during childhood and can lead to bone deformities and fractures. Achondroplasia. Achondroplasia is a genetic disorder that results in short stature and various bone abnormalities. It is the most common form of dwarfism and is caused by mutations in the FGFR3 gene. Sickle cell disease. Sickle cell disease is an inherited blood disorder that affects red blood cells and can lead to bone pain and complications like avascular necrosis due to reduced blood flow. Osteogenesis imperfecta. Osteogenesis imperfecta, or brittle bone disease, is a genetic disorder characterized by fragile bones that break easily. It is caused by mutations in genes responsible for producing collagen, a protein essential for bone strength. Ewing sarcoma. Ewing sarcoma is a rare cancer that usually arises in bones or soft tissue. It primarily affects children and young adults and requires a multidisciplinary approach, including chemotherapy and surgery. Rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease that causes inflammation in joints, potentially leading to bone erosion, joint deformities, and loss of function. It requires a comprehensive treatment plan involving medications and physical therapy. Chondrosarcoma. Chondrosarcoma is a malignant tumor that originates from cartilage cells within bones. It tends to develop in the pelvis, ribs, and long bones, and treatment involves surgery, radiation therapy, and sometimes chemotherapy. Osteochondritis dissecans. Osteochondritis dissecans is a joint condition where a piece of cartilage and underlying bone becomes detached from the joint surface. It can lead to pain, limited joint movement, and the risk of developing loose bodies within the joint. Bone infections. Bone infections, such as osteomyelitis, can occur due to bacterial or fungal agents. They can lead to pain, swelling, fever, and the need for antibiotics and sometimes surgical drainage. Gout. A gout is a form of inflammatory arthritis caused by the accumulation of uric acid crystals in joints. It leads to sudden and severe joint pain, primarily in the big toe, and requires medication to manage symptoms and prevent flare-ups. Spondyloarthritis. Spondyloarthritis is a group of inflammatory diseases that affect the spine and joints, causing pain, stiffness, and reduced mobility. Treatment includes medications, physical therapy, and lifestyle modifications.